Good afternoon, everyone. Welcome to the second viewing of the personal outcome measures for indicators 8, 9, 10, and 11, using environments, living in environments, interacting and participating. Well, we were kind of cut short on the last one, so if some of you are back again, welcome back. And for all of the newer ones or the first timers, welcome. This is going to be recorded. And Kathy, did you want to say anything?
I would just say that you can download the handouts. So if you wanted to have the scenarios in front of you, you can download the handouts from the handout tag. If you have a question, you can type it in the question box and we'll be monitoring that throughout the webinar. And then when Jill says, are there any questions, then I can read them to her. So thank you and enjoy the presentation.
And so we've got 4 to go through in an hour. So let's get started. For brand new people, I just a little bit about to talk to you about who Joe is, because this is an ongoing series of Joe's life. And I just wanted to give just a little background if you don't have all of the things in front of you or you're brand new to these sessions. We are talking about Joe's life from beginning to end with this 6 series webinars. Joe at this point lives in a group home with 5 other people. So there are 6 men in the home that he resides in. He communicates differently and shows some displeasure by using his voice and sometimes moving away from staff. Staff are his interpreter, and they are looking to have some sort of communication system at some point. It is not in place yet. He takes some medication and has no guardian, proxy, or power of attorney for any decision making. There are some group home rules. He uses a wheelchair to navigate his environment. There are some assessments in place, and he's lived in this house for a little over 2 years. And so with that, we're going to just go on to people, or Joe uses his environment. This is kind of long for new people. I do read this out loud so that we know that everybody's at the same time frame and place in the scenarios. So Joe has staff to assist him in some of his personal activities. He uses his wheelchair to move about his home. He will push himself backwards when the footrests are removed from the chair, as well as when he is at the day training site. He requires assistance moving from his wheelchair to the shower chair, as well as getting into his bed. Excuse me. Joe tries to stand up, and staff report that with his help, only one person is needed for both moves. He uses the grab bars, and the shower has a handheld spray that Joe likes to use. Staff help wash his hair and his back, and then staff put shower gel on a shower puff that Joe washes the rest of his body and rinses himself. Joe has grab bars by his bed to support him there also. The kitchen has been modified and is accessible for wheelchairs. The laundry room is off the kitchen, and everyone uses the washer and dryer. Staff assists Joe with his laundry as the washer is top load and Joe cannot reach the dials. He does, however, help with putting his clothes in the dryer and taking them out. Staff asks Joe if he wants to help fold clothes, and if he wants to help, he reaches his hand to staff, but most of the time he does not show an interest. Joe will hang out with the staff during laundry activities, but mostly he just visits with staff while they do most of the work. The program manager checks in with Joe while he is doing laundry. They are aware of level of participation and interest. They discuss it with Joe. He indicates by his behavior that it is okay and is not upset about it. Staff state that Joe seems to like being a part of the day-to-day activities and is offered opportunities in the home and does not have any formal programming for chores. Joe has been assessed for communication devices and is scheduled to receive an iPad next month at next month's speech therapy appointment. In the meantime, staff has started to use a simple yes and no system, trying to determine choices of activities. Community activities is an ongoing process to determine Joe's likes and dislikes. We look at the personal outcome questions. We poll at this point, and does Joe have maximum access to each of the physical environments he frequents at home, at work, and in the community? For each of those environments, if the answer to one is no, what most limits his ability to access? Lack of staff, lack of training, lack of equipment, technology, environmental modifications, transportation or organizational rules and practices. Does Joe use the physical environments he frequents? The answer to 1 and 3 are both yes, the outcome's present. If the answer to 1 and 3 is no, is it due to informed personal choice? And if so, then the outcome is present. So now Kathy will bring up a poll, and you'll have, about 15, 20 seconds to kind of look back over the scenario. I'll put that back up in case you don't have the handouts, and make your decisions on whether the outcomes are present for Joe. We'll close the poll in about 5 seconds. 3, 2, 1. We will close the poll.
So Jill, this is pretty much pretty close, actually. 40% of us think that the outcome for Joe is present, and 60% say no, the outcome is not present.
And the no's have it. What the reason for some of you that have been on the past ones, there were some issues with the treated fairly, the rules of the house, because there are some rules that limit accessibility, locked places, knives, the refrigerator must have permission, the doors have alarms on them, and so that outcome is not present because he does not have maximum access to that because of not necessarily staff supports, but environmental modifications or rules and practices. We'll wait for questions until after we do the supports. So for the support questions for Joe and use of his environment, does the organization know if Joe can access his environments at home, at work, and in the community? Has the organization assessed Joe's interest and ability for personal access and use of environments at home, at work, and in the community? Have those modifications been made to promote maximum access and use for Joe if needed and requested at home, at work, and in the community? Based upon these questions, are the supports in place? We will have a poll. About 5 seconds. 3, 2, 1. Close the poll.
So Jill, overwhelmingly, we've said that that the supports are not present. There's some variance in whether or not there are developing plans, if there are aware but no plans, or if there are no plans in place at all. And then a small percentage, 9%, said the supports are in place for Joe.
Okay, and very good. And again, each time that we discuss the supports with the no developing plans, no aware but no plans, or no just not in place, many times that is for your data entry and for your success of moving from they weren't in place, now we're aware, and now we're developing. But again, overwhelmingly, the answer is no all the way around. Again, there's no intentional assessments for all areas. There are some assessments, but assessing Joe's specific interests and ability for accessing his environments, as we don't have the proof or evidence that those assessments have taken place. Now, are there any questions? I can stay back on the support questions or move back to the individual outcome questions also.
So, Jill, the first question is, in the scenario about Joe, you talked about that he can't reach the dials. How does that, there are machines that he might be able to reach. How does that influence, or what factor, how does that play into the decision?
You know, that's one part of it. And so, you know, staff is asking, I mean, they're looking at it. It's just one of the accessibility issues. I was trying to just show you an example of one of the things that we would be looking at to make that more accessible to him. We don't expect an organization to go out and buy the brand new stainless steel front loading, you know, $1,500 things, but we need to continue to try to assess whether he's even interested in it or not for Joe specifically.
Okay, and the next question, Jill, has to do with the additional considerations. And so, not necessarily for Joe, but for somebody who has some limitations, say that they have Prader-Willi and can't manage their food intake well or independently, and so there's limitations to their access to food and drink. And is that due to their, if that's due to their limitations, would the outcome be met?
It's possible. What we would want to make sure is that that assessment, and that we have done, you know, that has gone through, of course, Human Rights Committee, and that we're looking at that as a restriction, and we know that it is a diagnosis. But what are we doing to help that person, not Joe particularly, but that person to have some access to some things that he or she might not be able to access the entire refrigerator or freezer. But do they have their own refrigerator, their own snacks that they can have unlimited? Do they have their own space in their room? So it would be looking again to modify for an accessibility for that person based upon their own limitations and needs.
Okay, and then the next question, Jill, is around transportation. So we know that transportation is a consideration here, and it hasn't really been talked about. How do you know when to ask questions about transportation when you're doing the interview? When would you not ask that question?
When would I or would not ask?
When would you or when would you not ask the question?
Okay, well, we would be talking about that probably from the beginning, and we may have heard of that in other places. The use of environment does include transportation, and it has not been addressed yet. But it would be all of those things for participation and interaction, and I believe we're going to be talking about that a little more today. But we do talk about that for any time for the use of environments. It might come up in a few different areas.
So, and then one last question I think we can have for this section. If there's a restriction for access to something and it's been reviewed by the Human Rights Committee, is the outcome met or not met?
This is not necessarily about the restrictions. We've talked about restrictions and those things in rights and treated fairly. This is the maximum access for that. The restriction, if you're talking about like the Prader-Willi, again, it would be in here, but for the additional considerations, we would need to look at those things if it is an individual-based restriction. For him, for Joe, we have no clear-cut assessment that says he is or isn't interested, and that we haven't continued to kind of find what he has an interest in or not. They're doing a little bit.
Okay, that's it for the questions for this one, Jill.
Excellent. We'll move on then to people live in integrated environments. Sorry, I've got a little cold coming on, so I apologize for the coughs. Joe lives with 5 other men in a licensed group home. He receives day services provided by his residential provider. The day services have scheduled community activities, mostly during the summer months, as weather is many times a factor during the winter, where Joe lives. Staff stated that Joe really seems to like going to the library, YMCA, swimming, van rides, and in the summer, he is content when he is outside doing almost anything. Winter months seem to be a little tough for Joe. He's just not as happy. Staff have what they call an activity log that they keep for everyone. Staff stated that there are times when Joe will go with only one staff. However, it is usually with at least one other housemate. He seems to enjoy being in different situations, if it is not in large groups, and also if he has a staff with him that he knows. The organization requires that every person has an activity in the community at least one time a week, and that is happening. Outcome for this, we will poll after I read through these. Does Joe use the same environments used by people without disabilities? Living, work, school, community, leisure, shopping, banking, place of worship, or other? If the answer to that is yes, the outcome is present. If the answer is no, is it based on informed personal choice? If due to personal choice, the outcome is present. We will poll. In about 5, 3, 2, 1. We'll close the poll.
So Jill, for this one, most of us, the majority, think that the outcome is not present for Joe. 26%, or about a quarter of us, believe that the outcome is present for Joe.
The outcome is not present for Joe. He lives in a group home that they have not assessed whether it is informed personal choice that he wants to live in a congregate setting with people who also have disabilities and receive supports. His daytime is spent in a service provider's setting. Again, there is no assessment that is based on informed personal choice, that he wants to be in that, as well as, and he has some community. We don't have a lot of information on whether the type and frequency is what he wants, or if he's doing those. And again, is it based on an informed personal choice? There are no real assessments that we have seen. We'll go to the support questions for living in an integrated environment. Does the organization know what integration means to the person, or are efforts being made to learn about the person's preferences? Do those services and supports for Joe promote opportunities for integration, living, work, school, community, and those other things? And based on the answers to these questions, are individualized supports in place to facilitate Joe's outcome of living in an integrated environment? We will poll. Kathy's ahead of me. in 3, 2, 1. The poll is closed or closing. There it is. So for the supports for Joe, survey says.
So very few people. There are about a little over 100 people on the call. So those of you that are, trying to figure out how many people 1% is, it's approximately 1.1 person. So there, one person probably says the supports are not in place. The other 112 people say that they are in place, are not in place. So no, they're
wait a second. What? If they're
not in place.
Okay.
112 people probably say they're not in place. Most of us believe that they are not in place at all, although there's some that think there's some awareness and no plans, and a few that think there are some developing plans.
Right. Okay. What you first said, I didn't know where I was going to go with that. The answer is no. The individualized supports are not in place to the supports for Joe. There's no real intentional efforts to determine what integration means. And that's one of the things when we're talking about this many times in classes, it's that we have to know what integration means to the person. It just kind of sitting in an integrated environment doesn't really give us what integration means to each person. So those efforts, which you would also have, there have to be some robust efforts to learn about what the person's preference to integration means. And so you are right, it is not in place, even though there is some awareness, and they're starting to do some things, although supporting 1 time a week, it might be hard to determine if that is an integrated environment at just 1 time a week for Joe. Are there any questions regarding either the outcome or support in this?
So here's a question about the outcome.
Okay.
Is it possible for someone who lives in a licensed group home or an IRA or supported living arrangement, whatever it's called in each state, is it possible for them to be to have this outcome met?
The short answer is yes. The little longer answer is as long as we know that it is based on informed personal choice, and that it's not just is it a preference or is it the only? And so there has to be lots of education and exploration and exposure to those other areas so that people can say, I want. And I've met any number of people. It's not particularly common, but it's not that rare either. So yes. The same can be true, if I can just add on that, the same can be true for the supports. I mean, I'm sorry, for the living and daytime activities, depending on, many times depending on age and what you want and those sort of things also. So yes.
So we have a few questions about this. The first question is, what are some examples of agencies and how are they assessing what integration means to the person? How might that look across providers? What might that assessment look like?
It might not be that kind of formal checklist assessment, but when we're talking about assessing what people want in their lives, efforts being made to learn about the person's preferences, which is 9A, as well as being able to have that documented somewhere so we don't lose it every time that a new person comes. And so an example might be that I live in a licensed group home. I may have chosen that because it was my only preference with a couple people that I like, but I want my own apartment. And we've known that for some time. And so that would open the conversation to talk about what does that mean to you? What's the difference between living with a couple people, even that you've chosen, but there's staff there, and the difference between that and living in an apartment. So that conversation would be, again, we're jumping ahead to where people live, but that's where a way of finding out what it means to the person. I mean, I wouldn't just sit down with someone and say, what does integration mean to you? It's more about talking about maybe the side door of coming in and talking about, do you want to go to when you go out in the community or go to a dance, do you not want it at 2:00 in the afternoon, but would you rather go to a dance club or somewhere there's live music in the evening? And so we start to look at that and where people want to work also for those daytime activities. Someone that's saying consistently, I want a job in the community because that's how we describe it to folks is, or a real job. It might promote, again, that opportunity for the discussion to talk about what that means to that person and have that somewhere.
So this question really, Jill, is closely related to that. So if in that kind of assessment, and Joe would indicate either by saying or in some other way that he likes to go to dances, but he prefers to go to the dances that an agency operates and not, say, to a nightclub, would that be a way to say that part of the support is present?
Sure. If we've done our job in making sure that it's an informed individual choice, we're not saying that people cannot go to those. We're just saying that there should be an array of options providing. If you look at your values and principles for the organization in your manual on page 9, we talk about that exposure to and acceptance of a wide diversity of people. Opportunities for building social capital are increased when people live within their community, and for the organization ensure that the environments where people spend time are determined by their preferences and not all. It's not a preference versus only. So we look for those arrays and promoting the chance for social capital.
Okay, thanks. And another question is, how can you really effectively answer these questions for someone who with severe and profound intellectual disability who doesn't verbalize their preference or demonstrate significant interest?
Great. And I think what you're asking is that significant? And we certainly have people that we are interpreters for. And so there are many times we may never know what the true outcomes are for people, that they may not be choosing the type and frequency of those things, but we just continue to look for any supports that we know of, and again, not losing that information, which many times we lose. Everyone communicates in some way, and our direct support professionals are the folks that we need to be talking to all the time about what is a person's demonstration of okay or not okay. So we are continuing to the efforts to be made, and the efforts to be made to learn about the person's preferences could make the individual support questions present, even though we may never know the actual outcome.
Okay, and so then this is kind of a double part. So before, when you were talking about that Joe lives in a home and we don't know if he chose, how do you distinguish live in integrated environment from that other outcome around choosing where and with whom you live? Because we certainly don't want to double whammy people with no and multiple personal outcome measures, because work and live might be addressed in this other outcome.
It may. Living in integrated environments is in all three areas. If it's just the actual living space that we're looking at, we would again, as the whole person, and since we're breaking these up in 3, 4, and 5 outcomes at a time, it might be something that we would go back to, and I'll keep that in mind when we go to the living area. But for this one, for all 3 of those, for Joe, if the person has chosen the living, then that person would have also chosen the living here. We're talking about double whamming, but I don't think with this particular one, when we look at the principles and the values and the exact questions for the entire world of the person in integration.
Okay, and then one last question, right now anyway, is so what are agencies doing around providing options for people when the only option that's readily available is a segregated day program?
Well, that would be the only option from a provider organization. We would certainly, I don't know the whole, you've just given me a little piece of that, so there would be lots of discussion about what does that mean for Joe. There are other things to do, but day programs and other funding streams and so we would be looking for what is it that Joe wants to do. We already know he likes going out in the summertime, and winter is not so good. So for Joe, come summer, what are we looking at that's outside of the day program? If those of you that remember from the very beginning, one of the things that Joe has some trouble with is in the morning going to the day program or going to the day services site. And so, again, we're going to be looking for what are those efforts are for his preferences. Why is it that he has trouble in the morning? Why is it that, so that would be, we would be looking at all of those things around the opportunities to not just go to a day service site.
Okay, thanks. I think that answers all of the questions that we've been asked so far. So I think we can move on.
All right, excellent, good questions. We're talking about interacting now with other members of the community. Remembering this is a type and frequency. When we talk about action, people interact, there has to be an action to be interactive with people. So as we go forward, we interact with other members of the community. For Joe, the organization has an assessment for preferred activities. The activity log records the type and frequency of activities, and staff state they are attempting to find out what it is that Joe wants to do. They state that it is hard to determine the satisfaction level of Joe's interest in interacting. He is polite when checking out at a store and will accept the money staff give him to pay for the items. Staff are hopeful that when Joe gets his iPad, there will be more opportunities to talk to people. Joe attends a church that is accepting of people from the organization and has more contemporary music that he seems to enjoy. He is not a member of the church and has no other roles in the church. Staff stated that Joe likes hamburgers and French fries, so they will order for him at restaurants. Most times the house will order delivery or go through the drive-thru and take food home to eat. Joe is on a dietary restriction and does not have a lot of extra money, so they only have these items one time a week. This is many times the one activity that the people in the home go on weekly. So the questions are, is there direct interaction between Joe and others in the community? Is the type of interaction satisfactory to Joe? And is the frequency of interaction satisfactory to Joe? The answers to 1, 2, and 3 are yes. The outcome's present. If the answer to 1 is no, is it based on informed personal choice? If so, the outcome is present also. If you are looking in your manuals, there are additional considerations. And the poll is open. About 5 seconds, 4, 3, 2, 1. We'll close the poll.
Overwhelmingly, 95% of the people on the call say no, the outcome for Joe is not present. And 5% say that Joe does interact with other members of the community and the outcome is present.
Kathy, you need to close the poll, the hide poll results to enable screening. Thank you. That is correct. And it's because we basically don't know. There is some, but if we look at it, staff are kind of ordering for him. They kind of go through drive-through, and the activity log, although recording when he goes, frequency, and what he does on those activities, it's not a type and frequency for Joe. It's simply a documentation of what they're doing, not if they want to do something else. So for the supports, has the organization assessed the type of interactions Joe has with other members, assessed the frequency of his interaction? Does the organization know Joe's preferences for interaction, or are efforts being made to learn about the preferences of interaction? Does the organization provide support for Joe to access opportunities for interaction with others if needed and requested? Based on the answers to these questions, are supports in place for Joe? We'll open the poll. And we'll close in 3, 2, 1.
So Jill, again, almost everybody on the call says no. The supports are not in place, and 65% say they're not in place at all. 1% says that the supports are in place.
Okay. 65% is the answer that we here at CQL have come up with, simply because the assessments of the type, when we look at these supports and to read them very carefully, as the organization assess the type of interactions he has, they have an activity log, but the assessment of those interactions it is the missing part of this, the key to it. Again, the organization assessed the frequencies. We have a log that documents when he goes, but the assessment of, does he want to go more often? Is he moving toward the door? Is he asking for other things? Does somebody know what he really likes to do, and they're bumping up those frequencies? And C, does the organization know the preferences for interaction, which comes from the assessment of the types? So the efforts to be made to learn about that, they're getting some of the documentation. So now we need to go back and really look at the assessment of those. And for Joe, who communicates differently, that assessment may look very different because we're just not talking to him. We're looking at, there may be additional things on his assessment to find that out, such as staff may do a line of how Joe reacted to where they went. If they went to the example, if they went to the zoo and he kind of screamed as he saw the animals in cages, we might want to say that probably wasn't where he really wanted to go that day. Are there any questions?
There are no questions about this.
Okay. You guys rock. Here we go. We'll go on to people who participate in the life of the community. Joe is supported to do things in his immediate community. He will go shopping for his personal needs, attends church, and gets his hair cut at Walmart. Staff state that Joe doesn't complain about any place that they take him unless it is a big crowd. The activity log in the home indicates that Joe is always ready to go out when anyone is leaving except in the mornings. In fact, if someone else is leaving, Joe will begin to move himself toward the door. The day staff also report that Joe is a willing participant in activities that involve leaving the building. Staff again indicated that Joe prefers summer when he can be out of doors doing almost anything. Joe had his birthday last week, and he and one of his housemates, along with one staff, went out to eat at Cracker Barrel, and he celebrated turning 35 years old. Staff stated that he enjoyed this. When questioned, staff said that they thought Joe would like to do more new activities, but said he was busy during his week and didn't think he would want to participate more frequently. The questions are, does Joe participate in the life of the community? Is Joe satisfied with the type of participation he has? And is Joe satisfied with the frequency of his participation? 1, 2, and 3 are yes, the outcome is present, again based on personal informed choice, remembering this is a type and frequency outcome. Poll open. And 5, 4, 3, 2, 1. Poll close.
So we have a little more disparity on this one, Jill. 14% of the people on the call say that the outcome is present for Joe, that he participates in the life of the community. 86% say no, the outcome is not present for Joe.
Oh, okay. I thought you were going to say something else. The support is not present for Joe, or I'm sorry, the outcome is not present for Joe. He's ready to go anytime. We're still, again, looking for the type and frequency. Is he satisfied? When in the scenario, he moves himself toward the door if someone is leaving. He likes to, again, the willing participant to activities that involve leaving the building. And certainly as summer is coming up, that type and frequency may change, which is a really good thing to know about Joe, so that there might be some other things that he could be doing in the wintertime, so to participate when it's not quite so nice outside. So the satisfaction is unable to be determined at this point. They think that he likes new activities, and which is a great thing to think and start to explore with him. Okay, we go into the supports. Does the organization know what Joe would like to do in their community, or are efforts being made to learn? Does the organization know how often Joe would like to engage in community activities, or are efforts being made to learn? Does the organization provide Joe with access to information about options for community participation? And does the organization provide support for Joe to do the things he wants to do? Based on these answers, the poll is open. There are additional considerations. And we'll close this in 5, 3, 2, 1. Please close the poll.
So again, Jill, overwhelmingly, most of the people on the call say the supports are not in place. a small number of people say the supports are in place.
And that's correct. Now they're starting to do some things, and we're very pleased with that. But for that robust support of knowing what he wants to do, those preferences, the activity log again is there, but he's always ready to go. He doesn't seem to really refuse anything that has to do with leaving either the home or the day program, unless of course it's in the morning or it's really cold or they're going to a big group. So providing support, again, this is really starting to question those EEEs and starting to get into options, and are we asking and then taking our AAA, ask, act, and advocate, especially when it comes to participate. Again, with Joe, we're going to have to be pretty vigilant about writing down those things that staff observe so that we can understand how he's communicating these things to everyone.
So Jill, the first question is, can you give us some examples of some questions that you ask to learn from when you're talking to somebody who doesn't use a lot of words, to learn about what type of participation they want to have and learn about the frequency?
Those folks that communicate differently, again, we do depend a lot on our interpreters. So we always want to have someone that knows the person very well. I use many of the questions in the manual. In the follow-up questions, I use the questions about the outcome for the person when I'm talking to the person. I mean, I always direct the question to them, of course. So the question about the outcome on page 49 would be, I just ask the person, what would you like to do in your community? And then I would have talked to the person and the interpreter about this, because I would make the question to the person and then want the interpreter to answer that question. So, recreational fun things do you do? There's suggested questions for the person. I never turn away from that person, so we just expect that interpreter to start after a few seconds so that I can see if I can interpret any answers from the person. So I would always be watching them to see any a smile, a blink, a grin, a grimace, if it's to the zoo. You might know, anyway. And then, for the follow-ups, we're talking for those supports again. How do you inform the person? How do you know? How are you making sure that everybody knows that? What is your documentation so that I know it if I'm a new staff? Are you using a person-centered plan? Are you using what I like best? Is it part of their plan? Is one time a week enough? What are we seeing that's going on with that? And that would be for anyone, sighted or they can hear and have other means of communication.
So in the discussion with the staff, they said that he was busy
Right.
during the week.
Yes.
So what kinds of questions might you ask to get at why they say that?
Sure. And that would be absolutely, and I put that in there specifically for that, so thank you for asking that. Said he was busy during the week and didn't think, but think is the word that we look at. So it would be like, well, that's just what I would ask. What does he do during the week that you don't think he wants to participate more? How do you know that? Does Joe ever refuse to go during the week, or is it because we might have some staffing issues? Is it because we had a storm? That we can't do anything about. People that have laundry, he lives with 6 people, so many times there are laundry schedules Monday through the week, and so maybe that's it. And does he really want to do his laundry on Wednesday, or is that, again, just kind of a house rule, and he really wants to go to church on Wednesday night? So, or that's an opportunity that we think, since he enjoys that church, that he might want to. So we need to adjust that. So again, of course, we would ask, tell me what he does during the week, and why you think he wouldn't want to go more. Or is it money? And are there things, there are a number of things that we might follow up on that.
Okay, thank you. So sometimes it seems like they're getting to know him and respond, that all of the things around the weather and the crowds. And then other times it's like he's having his birthday celebration and he goes out to the Cracker Barrel, and his favorite food are hamburger and fries. So what kinds of advice might you give this organization to really help to discover more about what might be important to Joe?
Right. And actually, I don't know that Cracker Barrel doesn't have hamburgers and French fries. However, thanks for bringing that up, whoever did that, because I thought that was interesting too. And I say go to Cracker Barrel, but maybe not on his birthday. To explore something else. If there's maybe somebody else really likes Cracker Barrel and wants to go there on the birthday, and Joe is invited to it. Getting to know, really, for Joe at this point, we need to find some communication, some ways to communicate with him other than him just becoming upset. And again, for the organization, they really need to be, for the supports for him, to be very, again, intentional about making sure that they keep that information and continue to explore. Did that answer that? I'm not.
We'll see if they ask a follow-up question.
Okay.
There are no other questions right now.
We actually have 7 minutes. Are there any general questions anybody would like? Or we can shut down. I thank you all for coming to this webinar. Again, if you're going to be able to join us next month, we are going to be going forward with Joe in the areas of Joe performing different social roles. We're going to be talking about where and with whom he lives, where he works, and where he works. Oh, I'm so wrong. I'm so wrong. Excuse me. We're looking at April, and I moved on to May. April's are numbers 12 through 15. Natural supports, friends, intimate relationships, and when to share personal information. And that is in April, again, on the 3rd and the 5th. The 3rd at 10 o'clock Central and the 5th at 1 o'clock. They are the same ones. They will be recorded. And if you are going to be able to join us, if you want to look at the past life of Joe, and we will see you next month. Anything else, Kathy?
Nope, I think that's it. So thank you all very much. Have a great rest of the afternoon, and we'll talk to you next month.
Okay, bye-bye.